The Supreme Court of the United States issued a ruling today that will affect how kids getting life-saving health care are affected.
In a 6-3 ruling, the court affirmed a ban on transgender care for minors in Tennessee. Legislators there passed a law limiting the kind of health care that these children receive. That includes hormone therapy and puberty blockers in most cases, surgery in some cases for individuals under the age of 18. Lawmakers in Tennessee decided that trans kids can still get mental health care.
The argument before the court was whether that law violated the equal protections ensured by the 14th Amendment. The majority found that it did not. Writing for the majority, Chief Justice John Roberts wrote that their role isn't to judge the wisdom, fairness, or logic of the law, just its constitutionality. Many justices shared written opinions on the issues, both in support and in dissent. Justice Sonia Sotomayor said this ruling abandons transgender children and their families to political whims.
Multiple studies have found that transgender kids attempt suicide at a much higher rate than cisgender kids. One study finding 80% of trans kids have thought seriously about killing themselves, while for the general population that's more like 20%. The Trevor Project, which provides crisis intervention and support for LGBTQ people, says this is largely because of how they are mistreated by society at large. Studies also find that just the simple act of accepting a teen's gender identity lowers that risk. Another study found that kids who received gender-affirming hormones had 73% lower odds of self-harm or suicidal thoughts. Now, 27 states have passed bans on gender-affirming care for adolescents.
Major American medical organizations, including the American Medical Association, the American Academy of Pediatrics, and the American Psychological Association, support gender-affirming care. Meanwhile, the Trump administration has officially cut specialized support for LGBTQ individuals who call the National Suicide Lifeline.
The New York Times broke this news just this afternoon, and we first told you the Trump administration was considering doing this last week. The Trevor Project provides that specialized support. They shared the stop work order with the New York Times. Funding for the hotline as a whole will stay flat, but this resource, which helped a population that is at a higher risk of suicidal thoughts, will soon be gone. That service was added just 3 years ago, recognizing that queer people are more likely to be rejected by their families and face discrimination in society. The service will run through July 17th. A reminder, if you need mental health resources, you're having thoughts of self-harm or of taking your own life, you're not alone. There is help available. You can call or text the Suicide and Crisis Line at 988.